So this skill is a long bone immobilization skill. The first step is to apply appropriate PPE, which is gloves. And then the next step is I'm going to have my partner stabilize the injury. My imaginary partner, because in real life situation I would have a partner. And then the next step is I'm going to assess the motor, sensory, and circulatory function that are distal to the injury and the injured extremity. So I'm going to assess the pulse. Can you wiggle your fingers, please? Okay, and then which finger am I touching?
The middle finger.
Okay. And then the next step, since I'm told that all those functions are present and normal, then I'm going to get my materials and make sure that they are the right size. And I'm going to apply them. Okay. Do you mind if you hold on to this for me? Okay, I'm going to secure it. Move your hand. Can you hold it again? Thank you. Okay, let go. And I'm making sure that the patient's arm is not being moved. And then in order to immobilize the joints and secure the injured limb to the patient's torso, I'm going to use the sling and sweep technique. I'm going to carefully pass it through. I'm going to make sure it's tight enough that it lifts the patient's arm. And then for comfort, if the patient needs, I'm going to apply padding, but in this case the patient doesn't need that. And then I'm going to secure the patient's injured extremity to their torso to limit movement of the joints. And then the last step in this skill is to reassess the motor, sensory, and function. So here's a hand, I'm going to assess the pulse. Okay, can you wiggle your fingers? And without looking, which finger am I touching?
The pinky.
Okay, and then I am told that the motor, sensory, and circulatory functions are present and normal. And that's the end of my skill.